Hello and welcome to New Mama Vibes channel. Childbirth is a unique and often unpredictable experience. While many women hope for a vaginal delivery, sometimes a cesarean section, or C-section, becomes necessary for the health and safety of the mother and baby. But did you know that there are actually two types of C-sections, planned and emergency? Understanding the difference between these two types of C-sections can help you feel more informed and prepared for the birthing experience, should a C-section become necessary. In this video, we'll explore the differences between planned and emergency C-sections, including the reasons why they may be necessary, the risks and benefits, and what you can expect during the procedure. We'll also discuss the emotional and psychological differences between the two types of C-sections and provide tips for preparing for a planned C-section and coping with an emergency C-section. Whether you're pregnant and curious about your options, or you're scheduled for a C-section and looking for information and support, this video is for you. What is a C-section? A cesarean section, commonly known as a C-section, is a surgical procedure in which a baby is delivered through incisions made in the mother's abdomen and uterus. C-sections are usually performed when a vaginal delivery would put the mother or the baby's health at risk, or when a vaginal delivery is not possible. According to the Centers for Disease Control and Prevention, around 32% of all births in the United States are delivered by C-section. C-sections may be necessary for various reasons, such as if the mother has a medical condition that makes a vaginal delivery risky, if the baby is in distress during labor, if the baby is in an abnormal position, or if the mother has had a previous C-section. Number 1. Planned C-sections. A planned C-section, also known as an elective C-section, is a scheduled procedure that is planned in advance of the due date. This type of C-section is typically scheduled for medical reasons, such as if the mother has a medical condition that makes a vaginal delivery risky or if the baby is in an abnormal position. Sometimes a mother may choose to have a planned C-section for personal reasons, such as if she has had a traumatic previous birth experience, or if she prefers the certainty and control that a planned C-section can offer. If a mother is scheduled for a planned C-section, she will typically have a consultation with her healthcare provider beforehand to discuss the procedure and answer any questions she may have. The procedure is usually performed under regional anesthesia, which means that the mother will be awake but will not feel pain. The healthcare provider will make incisions in the abdomen and uterus and deliver the baby. The recovery process for a planned C-section can take several weeks, and mothers may need to avoid heavy lifting and strenuous activities during this time. Number 2. Emergency C-sections. An emergency C-section is a procedure that is performed when a vaginal delivery is not possible or would put the mother or the baby's health at risk. This type of C-section is usually performed when a complication arises during labor or delivery, such as if the baby's heart rate drops, if the mother's uterus ruptures, or if the mother's labor is not progressing as it should. An emergency C-section is typically performed under general anesthesia, which means that the mother will be unconscious during the procedure. The healthcare provider will make incisions in the abdomen and uterus and deliver the baby as quickly as possible to minimize any risk to the mother or the baby. The recovery process for an emergency C-section can be more challenging than for a planned C-section, as the mother may be recovering from a medical emergency in addition to the procedure itself. Risks and complications. Like any surgical procedure, C-sections come with some risks and potential complications. These can include infection, bleeding, blood clots, and damage to nearby organs. Additionally, mothers who have a C-section may have a longer recovery time than those who have a vaginal delivery, and may be at increased risk for future pregnancies. To minimize the risks of a C-section, it's important to follow all of your healthcare provider's instructions for before and after the procedure. This may include staying in the hospital for several days, taking prescribed medications, and avoiding certain activities until you are fully healed. In addition to the physical differences, there are also emotional and psychological differences between planned and emergency C-sections. Many women who have a planned C-section feel more in control of the situation and may experience less anxiety or fear leading up to the birth. On the other hand, women who have an emergency C-section may feel a sense of disappointment or even failure if their birth plan didn't go as expected. It's important to remember that every birth experience is unique, and there is no right or wrong way to give birth. If you're scheduled to have a planned C-section, your healthcare provider will give you specific instructions on how to prepare. This may include avoiding food or drink for a certain amount of time before the procedure, taking certain medications, and packing a hospital bag with necessary items for yourself and your baby. You'll likely be given anesthesia during the procedure, which may be a regional anesthesia that numbs the lower half of your body, or a general anesthesia that puts you to sleep. The actual surgery usually takes around 30 to 45 minutes. If you have an emergency C-section, the situation can be more stressful and unexpected. It's important to remember that your healthcare providers are there to support you and ensure the safety of you and your baby. You may be given a regional anesthesia if there's time, but in some cases, you may need to be put under general anesthesia. The surgery itself will likely be performed quickly and efficiently to minimize any potential risks to you and your baby. While C-sections may not be the preferred method of delivery for many mothers, they are sometimes necessary to ensure the health and safety of both the mother and the baby. Understanding the difference between planned and emergency C-sections and the potential risks and complications can help mothers make informed decisions about their birth plan. Remember to discuss any concerns or questions with your healthcare provider, and always prioritize you and your baby's health. Overall, whether you have a planned or emergency C-section, it's important to stay informed, ask questions, and advocate for your own health and the health of your baby. Your healthcare team is there to support you, and there are many resources available to help you navigate this experience. Thanks for watching New Mama Vibes channel. Don't forget to subscribe, like and share our videos.